All right, so we're looking at an anteroposterior radiograph of the pelvis from an adult female. The key finding here is focal thickening of the lateral cortex in the left proximal femur, and there's a transverse lucent line running through it. This suggests the presence of an insufficiency fracture. Now, if we shift to the right femur, we can see a similar thickening of the cortex, but there's no obvious fracture line on that side. Importantly, the medial cortex appears intact, and there's no sign of an underlying destructive lesion on either side. At this stage, a few differentials come to mind. First, we should consider osteomalacia, especially given that it can cause a generalized thinning and weakening of the bones, but typically this would present more diffusely, without the focal thickening we're seeing here. Another possibility is a stress response or fatigue fracture, particularly in athletes or individuals engaged in repetitive activities. However, these fractures usually occur in the setting of abnormal stress on normal bone, and we don't have clinical information pointing to that. Another consideration would be metabolic bone diseases, like Paget's disease, which can also cause cortical thickening, but the pattern here, focal thickening with transverse fracture lines, doesn't quite fit the chaotic, disorganized appearance we would expect in Paget's. Now, taking into account the patient's clinical background, particularly if they're on long-term bisphosphonate therapy, we start thinking about bisphosphonate-associated insufficiency fractures. These fractures typically occur in the proximal femur, exactly where we're seeing these findings: thickened lateral cortex with transverse lucent lines and an intact medial cortex. So while we can't be entirely conclusive based on this radiograph alone, given the imaging features and the typical distribution in the proximal femur, this pattern is very much in keeping with bisphosphonate-associated insufficiency fractures. I would certainly discuss the case with the referring clinician, especially if the patient has a history of bisphosphonate use, and suggest considering a bisphosphonate holiday to prevent further fractures. Examiners might ask about distinguishing these insufficiency fractures from other causes of cortical thickening. It's critical to highlight the differences. Osteomalacia typically involves diffuse cortical thinning. Paget's shows cortical thickening, but with a much more chaotic bone pattern, and fatigue fractures are more common in athletes or individuals with repetitive stress on normal bone. To conclude, this case leans strongly toward bisphosphonate-associated insufficiency fractures, but as always, clinical correlation is essential. And of course, if you found this breakdown helpful, don't forget to subscribe to Radiology Made Easy. If you have any questions or cases you'd like to discuss, drop a comment and we'll keep learning together.